Hello, I'm Dr. Roberto Carricchio. I'm the chief of the Division of Rheumatology at UMass Chan Medical School in Worcester, Massachusetts. And I'm also the director of the Lupus Center at UMass Chan. I'm joined today by Miss Ruth Wilson, who's a patient with lupus, but it's much more than that. She's also a very strong advocate at the national level with a number of foundations, and also the director of our lupus support group in our center. Ruth, welcome.
Thank you so much for having me, and thank you so much for that very gracious introduction. I really appreciate your invitation to be here today.
You had a very complex course and relatively long now, and that means, though, that you must have gone through a number of therapies through your journey. Can you share this experience?
So throughout my journey with lupus, right, I've undergone various pharmacological therapies sort of aim at controlling, the disease activity and minimizing symptoms. These have included immunosuppressants, corticosteroids, antimalarials, biological agents, and each treatment modality has played a role in managing my condition, and but I've also encountered challenges and a lot of side effects along the way. So currently I'm content with the treatment regimen that I'm on, although I feel like there's always room for improvement, and you should always have those ongoing discussions with your healthcare team and sort of optimize your therapy.
Very important point, and is important also, I think, to point out for the audience as well that in the last decade, over time, we went from rheumatologists, when we approach lupus, we went from some form of trying to control the disease to the best of our possibilities to actually have a goal, which is treat to target. So we now have a very different approach where we can. We obviously don't succeed every time. Actually, we succeed in a minority of cases, but the goal is to actually put the patient's disease into low disease activity state, so very low level of activity, and we pushed toward, we had ways to measure that as well. So our approach is changed. We do look for trying to minimize the activity of the disease, right, rather than just be happy with some mild form of control. We are now pushing more and more toward a better control of the disease. And the patients themselves should be very strong advocate for that approach. Even though we have several new modalities to treat lupus, we have several new approaches, and the mindset that we are in when it comes to lupus patients' disease activity has changed. There are ways that patients with lupus can help themselves besides medications. And so do you have, you touched already a little bit on, but I'm sure you can expand on the concept of helping yourself with approaches that are non-pharmacologic, so that don't actually involve medications, but rather other aspects of tackling the disease. Do you have any recommendation, or can you share what you do to try to prevent as much as possible flares, besides taking, as you said, religiously your medications?
Yeah, of course. So, for me, I've found that stress and lack of sleep is a very big trigger. So obviously incorporating measures to my lifestyle that sort of reduce stress and help me with, dealing with the disease, right? So I do a lot of things like, other than having a gluten-free diet and dairy-free diet and taking vitamins, I've tried acupuncture. I do massages, like I get a massage like once a month. I go and get facials every 6 months. You know, I try to go like walking out for walks. If I can't work out, then I will go hiking on a day that's nice and, you know, wears copious amount of sunscreen. You know, then I also take like different supplements just to help me have more energy and sort of deal with the side effects from some of the medications. You know, a lot of the medications make me nauseous, so you know, I used to not drink like seltzer water, but I do now because it just helps my stomach like settle when I'm having those episodes of, you know, feeling nauseous. So yeah, and like I said, just prioritizing your sleep is super important. At least it is for me.
No, I think it would be for anyone, even for those who do not have lupus. Prioritizing sleep. We take sleep for granted, while instead it's 1/3 of our life that we need to take care of. And are remedies or more effective than others in your experience?
I think it depends on how my disease is that month, right? Like I said, I have like really big triggers, and it just depends. Like if I'm having a really stressful week at work, none of those things will help, right? Or they might help more than others.
But you brought an important point a few minutes ago, and that is recognizing the triggers, which I think is a very important. I mean, knowing yourself and approaching lupus by knowing yourself, because lupus, even though it permeates all aspects of a patient's life, there is still more than lupus in an individual, right? And so knowing yourself and knowing what can trigger or can facilitate the triggering of a flare, it's a very important aspect for a patient. Unfortunately, you know, one has always to pay attention to her own or his own body, but nevertheless, knowing those triggers and understanding yourself, I think it would go a long way.
Absolutely. Yep. Thank you so much for having me. This was a very useful information, you know, that I hope helps other lupus patients. So thank you so much for having me.
Thank you. And let's thank also the audience that has joined us today to listen to us, and especially to your story. Thank you very much.